Hi my lovelies and welcome back to the channel. It's your girl Matilda and I'm here with an exciting video. Okay, so a couple of you reached out to me on Instagram asking my advice on what type of nursing you should go into and why I feel like all types of nursing are unique in their own ways. I also concur to the fact that it's important for you to pick that one which calls your appeal. That way it's easier for you to go through the modules, assessments and all that good stuff. Okay, so in today's video I'm going to be telling us the types of nursing here in the UK and telling us bits and pieces of what they do, where they work and all that good stuff. Just a quick disclaimer before I go straight into the video. I am not a professional, I am a nursing student and all information I'm going to be giving you guys are strictly from my knowledge, research and asking those of my friends who are in these fields. Okay? Alright, so first on my list in no particular order at all is mental health nursing. Now, if you're someone who is an advocate for mental health, you're just keen on helping people mentally, emotionally or otherwise, or you're just that person who is really eager to help people out of like a very dark place, then this might be the type of nursing you would be interested in. So mental health nursing, as the name implies, caters for a patient's cognitive and emotional well-being. This comprises of how they think, feel and even behave. So as a mental health nurse, you'll be dealing with patients who have mild or severe mental health issues. For example, patients who suffer from depression, anxiety, suicidal thoughts, schizophrenia, bipolar disorder, you name it. Okay, all kinds of mental health issues. So these are the people you are going to be working with. As a mental health nurse, you are going to be an advocate for your patients. You are going to promote good health and provide care for them. You'd also need to establish a trusting relationship with your patients. That way they can easily open up to you about what is going on and how they feel. As a mental health nurse, you are not just providing care and support to your patients, you are going to be changing the negative stereotypes that surround mental health, as well as helping your patients live a life where they feel fulfilled. So, you can work in a ward or a psychiatric unit. You can also work in a community where you go to visit people's homes, or you can also work in a prison. There are other places where you can work honestly as a mental health nurse, but these are the few I'll mention in this video. So the next on my list I have child, children or pediatric nursing. I'm going to use these words interchangeably, however they all mean the same thing. Okay, so this branch of nursing deals with the care of children from birth to 18 years old. However, in some cases you might have age linger up to 25, and this is due to continuity of care. For example, let's say you have a patient who has been with the pediatric team for years and years. They might need time to integrate into the adult side of their care. Okay, but ideally you're going to be dealing with kids under 18 years old. Now, if you feel like you love kids, you understand them better, kids gravitate towards you, or you cannot just deal with adults generally, okay, because I know some people who are in children's nursing because they just cannot deal with adults. Okay, if that is you, then you might want to be thinking child's nursing. As a pediatric nurse, you are going to be dealing with all conditions that affect children, infants and young people. So you are going to be dealing with kids who have acute or chronic problems like trauma, asthma, cystic fibrosis, or even dealing with sickle cell crisis, depending on what setting you're working in. Okay, you'll be expected to provide support for children and their family by extension, be it emotional or mental. Think of it this way: so when kids come to the hospital, they don't necessarily come alone, do they? So they come with parents who are tense and want to know what's happening, what procedures has been done, what is the next step looking like and all that. So as a child nurse, you need to be able to provide information to these parents, relay and receive information as the situation arises. You have to make sure that they fully understand what's going on and what's going to be happening next, if that makes any sense. As a child nurse, your 6Cs must be in check. As to other nurses, you need to have like very good communication skills, because you're going to be dealing with infants who are in different stages of their life. Some of them might not be able to talk due to several conditions, or they are not just in that stage yet. So think about a child who is like 1. That child might not be able to communicate how they feel and all that. So yeah, you have to be able to identify deterioration. You have to be able to look at the kid and know that something is wrong and act accordingly. So playing is also like a huge part in child's nursing, because like kids really take things seriously. So sometimes maybe if you watch my previous video, really, you'd see Dara say that sometimes she have to play with them just to make them take their medication. So yeah, you need to be like flexible. You need to be like a very jovial person. You need to be that person who kids can warm up to, because like sometimes they just need to receive some extra TLC, tender love and care, for them to do what is best for them. Okay, so the next on my list I have learning disability nursing. This branch of nursing caters for the mental and physical well-being of a patient. This type of nursing is very core and person-centered, so you could be dealing with a patient from birth all the way to end-of-life care. And I also feel like this branch of nursing is closely knitted with mental health, so you're going to be working with a lot of people from that scope. As a mental health nurse, you'll be expected to improve the physical, mental, and social inclusion of your patients, because you'll be working with a lot of patients with learning disabilities. Did I say mental health? Did I say mental health nurse? I said learning disabilities nurse, I beg your pardon. So you'll be working with a lot of patients who have learning disabilities such as dyslexia, Down syndrome, autism, and all the rest. Guys, there's a whole spectrum for learning disability, okay? Some of the things we consider to be learning disabilities might not necessarily be one. For example, let's say someone who has like Down syndrome, that person might be able to go through life and do every other thing like any other person would. However, some other person might have the same Down syndrome and need support throughout their lives, okay? So learning disabilities is very individual. I cannot pronounce words. Learning disabilities is very individualized. So it depends, like it differs in different people, if that makes any sense, okay? Or you might see someone who has like cerebral paralysis and think that person has like a learning disability, while in reality that person does not. That person just have a deficiency in muscle control, if that makes any sense, okay? So as a learning disabilities nurse, you would need to have like a very good communication skills with your patients, their carers, and their family. You'd also need to be very, very empathetic and exercise a lot of patience. Patience, because people with learning disabilities need time to do things that other people might find common. So you need to be able to establish that patience with them, make them feel understood, and let them take their time in achieving a given task or anything like that. So if you're someone who has had a first-hand experience with someone who has a learning disability, or if you're interested in like holistic care, or you are just interested in this field, or you just find passion in helping this set of people, whatever the case may be, then do well to consider learning disability nursing. As to other types of nursing, you are going to be working with doctors, you are going to be working with your fellow nurses, you are going to be working with a lot of physiotherapists, you're going to be working with occupational therapists, you're going to be working with, just a whole range of the multidisciplinary teams in the nursing or in the health field, okay? You can also work in the hospital, health center, or community, people's homes, and anywhere you feel like you want to work, really, okay? So guys, we're finally in my specialty. In case you don't know, I'm a first-year adult nursing student in the University of West of England. So if you're still not sure, but deep down you know that you want to be a nurse, you want to take care of people for the rest of your life, or as long as you decide to be a nurse for, or you want to do a little bit of everything, then you might want to consider adult nursing. Because in adult nursing, we sort of do a little bit of everything. We're touching on mental health, we're touching on learning disabilities, health nursing, and all that, okay? So adult nursing is a branch of nursing that deals with the mental, emotional, physical, and overall well-being of a patient. So as an adult nurse, you'll be expected to assess, plan, coordinate, and manage care for your patients. You'll be working with adults of all ages, so from 18 and above. You'd also be working with adults who suffer from chronic diseases. It could be like a long-term condition such as diabetes, hypertension, arthritis, or even chronic lung disease. As an adult nurse, you are expected to have good communication and listening skills, and also be able to work as part of a team. You'd also be performing diagnostic tests, physical examinations, and monitoring patient health, as well as providing care, support, and advice to your patient. You, as an adult nurse, will be working with all the multidisciplinary teams across the health field. You can also work in like the hospital, you can work in the community, you can work in hospice, you can work in schools, you can work in like health centers, etc., etc., etc. So finally, guys, I also wanted to talk about midwifery because I know that some of us might be interested in that. I'm not so sure, so I stand to be corrected, but I do know that some schools have this in conjunction with nursing. So you have courses like nursing and midwifery. You do like a 4-year course instead of 3-year course, and then they have like midwifery, which is like 3 years. Okay, so but it's not necessarily a branch of nursing, if I do say so. Okay, midwifery is a science profession that deals with pregnancy, childbirth, and the postpartum period, as well as the sexual and reproductive health of women throughout their life. So if you're like a promoter of feminine hygiene and health, or you're just like all in for empowering women and stuff like that, then you might want to be looking into midwifery. Okay, so as a midwife, you're going to be working with a lot of pregnant women and their babies. You would be expected to provide all kinds of care for new moms or moms who have lost their babies unfortunately, and generally educating women about like feminine hygiene, pregnancy, postpartum period, contraceptives, sexual health, all that kind of stuff. Okay, you can also work in a hospital, like in a maternity unit. You can work in a private hospital. You can work in like community with other general practitioners. You can also work in like the prison, and so on and so on. Okay, all right guys, so that brings me to the end of this video. I do hope we were able to learn a thing or two and able to pick whatever branch of nursing that catches our interest. If after watching this video you're still not sure, please do pray about it and you're going to get the guidance you need. Okay, so guys, if you've watched till this point, please don't forget, oh by the way guys, happy to announce to you that we just hit 500 subscribers. So thank you guys so much. For those of you who subscribed to my channel, I'm really appreciative. And if you haven't yet subscribed, please do well to subscribe and join the family. Okay, thank you guys for watching, and I'm going to see you guys in my next video.